Triangular bandages may be used to cover or control bleeding or to secure a sterilized gauze pad over a wound. Triangular bandages may be used to limit movement of joints or fractures. This is called immobilization. Immobilization is performed to make sure that the fractures do not worsen when the patient moves. Parts of a triangular bandage. Start at the open face. In the open face, you will see the 4 different parts of the triangular bandage: the apex, the 2 ends, the 2 sides, and the base. Faces of a triangular bandage. The triangular bandage is most commonly used in the form of a narrow cravat. To get to the narrow cravat easily and in the fastest way possible, you may use the following technique. Fold the triangular bandage into 2 from the open face. Fold the bandage into 2 again and insert one hand until you are able to pinch the center of the fold. Repeat the process until you get to the narrow cravat. The hand cravat. For wounds on the hands, there are 2 types of hand cravats. Closed hand cravat. The closed hand cravat is usually used for cuts that occur horizontally on the hands of the patient. Start at a narrow cravat and place the apex on the wound. In this hand cravat, the hands are closed into a fist to put additional pressure on the wound and to control the bleeding. Aim for a crisscross pattern in wrapping the bandage around the closed fist of the patient. Make sure that the thumb is exposed to check for capillary refill later on. Wrap the bandage until both ends can be tied together. Open hand cravat. The open hand cravat is used as an alternative to closed hand cravat. Start at the narrow cravat and wrap the bandage around the open palm of the patient. Aim for a crisscross pattern. The open hand cravat is used for cases such as when the wound occurs vertically across the palm of the patient. This is because a vertical cut may worsen if the hands are closed into a fist. End with a square knot and tuck the ends in. Fingers should be exposed for capillary refill. Dressings for burns are more loose because we don't want the cloth to come into too much contact with the burnt area. We are only putting dressing over burned areas to prevent it from being exposed to dirt and microorganisms and to prevent the risk of the patient getting an infection. Cravat of the head. The cravat of the head is used for burns on the scalp of the patient. Start at the open face and cover the head of the patient. The apex should be found behind the patient. Note that the 2-inch fold is made on the forehead of the patient to hide the extra ends later on. Twist the ends of the triangular bandage. Tie it in front of the forehead with a square knot. Hide the knot inside the 2-inch fold. Pull the apex and secure it by rolling it back in. Lightly pull on a portion of the triangular bandage at the top of the patient's head. The dressing should not come off and should not be too tight. Cravat of the back or front. The cravat of the front or the cravat of the back is made to act as a cover for burns. Start at the open face and place the apex on the shoulder of the patient. Wrap the ends around the patient's torso and tie it with a square knot on the side same as the apex. The excess end will serve as a securing knot for the apex found above it. This technique is applicable for injuries on both the front or the back of the patient. Cravat of the jaw. The jaw cravat is used to immobilize the jaw. Start at a narrow cravat. Place the apex on the cheek of the patient. Wrap the bandage over the head of the patient and cross the ends over the patient's temples. Tie it with a square knot over the other temple. Tuck the ends. The patient must not be able to move his or her jaw. Arm sling. The arm sling is used to immobilize the arm. There are 2 types of arm slings. Normal arm sling. The normal arm sling is used for patients without clavicle fracture. Start at open face and tie an overhand knot at the apex. Then place the apex on the patient's elbow. Take both ends of the triangular bandage and put them over the patient's shoulders. Tie both ends behind the neck of the patient. Make sure that the hands or fingers of the patient are exposed to check for capillary refill. Always finish your dressing with a square knot. Tuck the ends. Alternative arm sling. The alternative arm sling is used for patients with clavicle fracture. If you suspect that the patient has a broken collarbone, you may use the alternative method of doing an arm sling. Start at the open face and tie an overhand knot at the apex. Then place the apex on the patient's elbow. Take the inner end of the triangular bandage and put it over the patient's shoulder. Take the outer end and insert it between the armpit of the patient. Tie both ends behind the patient. Make sure that the hands or fingers of the patient are exposed to check for capillary refill.